everyone, and welcome to a fireside chat here at the Giant Health event. And it's a great pleasure and honour to have Matthew Gould for this particular fireside chat, and I'm really looking forward to the conversation and hope you will also share that too. So Matthew Gould needs no introduction, of course. He's the CEO of NHSX, which has now been in existence for over 18 months now. And so it'd be great to explore how it's been shaping the future of healthcare. So Matthew, thank you so much for joining us. Oh,
it's a pleasure. It's very nice to have the conversation with you.
Yeah, so look, it's been, as I said, 18 months or so now. You've been in that position, and NHSX has evolved, I guess, over the course of time. So when I remember back when you first started, Matthew, you spent time in the hospital on call for a whole week, spending time with all the doctors, nurses, and the experiences from that has led to some change, I'm sure. Can you just share your current vision and strategy for NHSX compared to when you started, and perhaps where you're now thinking about the future?
So I think the essentially what we're doing boils down to three elements, which is really quite simple. It's digitize, connect, and transform. So we want to ensure that the whole of health and care, and the and care bit is really important here, but the whole of health and care have a base level of digitization, because if we don't do that, then we can't do anything else. And so one of the big changes I think we've made as NHSX is to create the second chapter for the provider digitization journey. The first chapter with the Global Digital Exemplars. I think they did a fantastic job at creating really digitally mature and advanced trusts that were doing exciting things and showing what can be done. We've made sure the second chapter is the Digital Aspirant Program, which is taking the less digitally mature and giving them help so that they can climb up that scale of digital maturity themselves. So number one is digitize. Number two is connect, where we have to make sure that patient data can flow safely and appropriately between health and care settings. I mean, we knew before the pandemic what a cost there was in terms of staff and patient time, in terms of patient outcomes and patient safety, that patient records so often couldn't flow between GP and acute trust or mental health trust or social care home. The pandemic has, I think, brought home to us really starkly how important it is that data can flow properly and safely, including between health and social care. And so, again, another big shift that NHSX has made in this space is to put our focus on ensuring a base level of shared care records right across the country. So the letter, for example, that Simon Stevens and Amanda Pritchard wrote out to the service on phase 3 made very clear that all the local systems are expected to have, by this time next year, a minimal shared care record in place. And we will be doing everything we can over the next few years to ensure the whole country, in every bit of the country, there is a shared care record that's effective in making sure that patient data can flow where it's needed safely. And then the third element is transform, because ultimately this is only worth doing unless it affects the patients and the citizen and the care and the support that they get. And so I think the highest expression of what we do is when we're actually using digital technology to reimagine care pathways. And that's been incredibly exciting. Together with Steve Powis, the National Clinical Director, Hugh, the Performance and Improvement Director, and their teams, we've been redrawing, rethinking care pathways for the key long-term conditions in particular, thinking about how remote monitoring using digital technology can improve care, create efficiencies, make a much safer, better, more effective care experience for the patients involved. And we're rolling that out, and I think it's very, very exciting. So it's digitize, connect, and transform. And then, with apologies for a long answer, but it's an important question. Underneath it, there's this underpinning objective of giving clarity to the front line around what needs to be done, how it can be done, and how they can get on with it. And we're really trying to express this in, I think, 3 key projects. There's our imaginatively titled What Good Looks Like project, which is being led by Sonia Patel, our brilliant CIO. And this is to set out for the first time in a very long time expectations about what systems and providers should be doing in digital and using digital technology to transform in very straightforward and simple, coherent ways, that if you're not a tech head, but you're the chief exec of a trust and you want to make sure your trust is doing the right things, will help you. Secondly is equally imaginatively named Who Pays for What, which, as the name suggests, is designed to give clarity to the front line about what they can expect might be funded from the centre and what they should get on with and fund themselves. Because I think that hasn't been clear. It hasn't always been predictable or stable. And that has been a disincentive to the level of investment, multi-year investment that we need to be made right across the front line. And then the third element is something that I know is dear to a lot of people's hearts in the NHS, which is creating much simpler, more straightforward, empowering guidance on information governance, where we got ourselves, I think, in a bit of a tangle with lots of very complex guidance and people being very nervous about doing the wrong thing. So during the pandemic, one of the very first things we did was put together a simple 1-page guidance note that basically said, if you're doing the right thing for your patients, you're trying to be sensible, then you get on with it. And this was endorsed by the Information Commissioner, by the National Data Guardian, and I think it had a really powerful effect. We've now created a portal, an IG portal, which sets out equally simple, clear, easy to use guidance for different situations for IG professionals and clinicians and members of the public. And I think we can have a big impact just by giving people the confidence and the clarity they need.
So thanks for that, Matthew. And I really like the way that you've kind of kept it fairly simple. Some of those project titles is as if it's labeled as it should be on the box, for example, which is great for our kind of the users at the end of that. But also the thing that's been impressed me so much is the rapidity, the speed of change that you've implemented across various systems. And it's been quite wide reaching. It hasn't been just small verticals, it's been wide reaching. So thank you for sharing that. Thank you for that kind of the work that you're doing on reimagining healthcare and you're saying transforming, which we all aspire to, of course. Going further afield, we've seen that the pandemic has now really changed the way people understand the digital language of tomorrow. We need to be able to become more literate in digital technologies, and part of the job, of course, is to translate that into the healthcare workers at the front line. So the question for me now is, so those are the vision strategies. So what is NHSX doing to embed that transformation digitally for the long term? What are the key things that you've been doing at the moment?
So it's a really good question, and embedding the change for the long term, I think, has as much to do with people and systems as it does with the technology. The actual technology that we're talking about for the most part, look, we're doing really exciting things in the AI lab. There's some very exciting cutting edge things happening right across the service, but actually what we're trying to do fundamentally is in technological terms, not that exciting. Where it gets tricky and interesting is in people and system terms. So I think, I would say there are 3 ways we really embed this. I mean, number one is the people side, where we've massively stepped up the investment we're putting into creating a digital ready workforce, working very closely with Health Education England, talking to the GMC and others about training. And we need to make sure that from the top to the bottom in every provider, there are people who don't necessarily have to be total computer geeks, but they need to be confident about leading and using digitally led change and transformation. And they need to know why it's important, and they need to know that they can do it. And they need to have the right people, but they don't need to be IT specialists themselves to lead that. So whether you're talking about the boards or chief execs or medical directors or clinicians or non-clinical staff. We need staff who are comfortable and confident and hopefully excited about what digital transformation can bring in terms of the care they give their patients and their quality of work. So really investing in people is one area. I think the second area is the NHS is making, I think, quite an important shift to system level thinking. So we've got our 42 STPs and ICSs, and they're going to be the core unit of geography for the future. And we've been working very closely with colleagues in NHS England and Improvement to make sure that the DNA for systems, the instructions that go out, the expectations and requirements have digital and data right in there at the heart from the start. And we're not retrofitting digital on as an afterthought, but systems should be making use of digital transformation and data as a core part of what it means to be an effective system. And the guidance that's coming out from the centre to systems will reflect that, I think, very vividly. And then the third area is just the clarity that I mentioned earlier, by making clear that some core basic things are expected of providers, different sorts of providers in health and care, by making clear how it is expected to be paid for, giving people clarity about what's expected, making it easy for them to do the right thing, not just issuing lots of instructions from the centre, but, for example, creating procurement frameworks so that people can buy compliant products, whether it's an EPR or a blood pressure monitor, that they know is going to be interoperable, they know is going to be efficacious because it's on a procurement framework that we've set up for them and can be bought easily. We need to make it easier for people to do the right thing rather than the wrong thing.
Yeah, and that kind of makes a lot of sense. Thank you for that, sharing that. I like the fact that you're opening networks, open standards, you're thinking about interoperability, you're thinking about collaboration has been a key term, where NHSX is part of a wider remit of other partners coming in, which I really like that. That's certainly that I feel the way the future of the healthcare system should work. So I guess, look, we've seen a lot of successes of NHSX over the last 18 months since you started leadership, of course. Also, we've seen some challenges, perhaps even some failures. Can you just give us a sense of what you've learned from all that, and perhaps share with the audience some of the successes and lessons that you've learned along the way?
So, things that have gone well, I mean, very simply, the deal we did with Microsoft, which we worked on with NHS Digital, I think massively helped, improved cybersecurity, helped put the tools that people need in their hands, and saved the service £300 million. That was a really nice and pretty important moment. I think the IG guidance that I mentioned, a page of really simple, empowering guidance for staff, for clinicians, had a big effect. The data store that we set up at the start of a pandemic, so that we could see where there were stresses and strains in the system, and make sure that the pandemic was being run and resources were being allocated based on measured need rather than anecdote and who was shouting loudest, I think had a really important effect. The deals that we negotiated for NHS staff with the telecoms companies, I think were great, and had a lot of take up. Setting up the COVID National Chest Imaging Database, building a database which can be used to train and validate AI systems on chest scans, I think really has potential to grow into something very exciting. Shipping out 40,000 laptops to the system at short notice at the start of the pandemic, I'm pretty proud of. creating the Digital Aspirant Fund, building the shared care record program. There's a load of things going on. A lot of it is quite slow burn, so it's not stuff I can point to and say, look, here is this fantastic thing we've built, because actually what we're trying to do is systemic change. And look, we've learned a lot. The process of creating a contact tracing app was, as I've said publicly before, a bumpy one. We did what we were set up to do, which was take on a risky project, do it properly, create optionality, test the options we built, and work out which one was best. We've now got an app which is, I think, got the best functionality of any of its kind in the world, and one of the highest levels of take-up in the world, and was the fastest downloaded app in UK history. So a complex story to get there, but we got there. What have I learned? I've learned change in health and care is really tough and requires, the best advice I had was from one of the people who I go to for advice, she was a senior NHS person, and I asked her what tools and levers you need to use to effect real change in the NHS, and she said all of them. And not only is that true, but it's all of them plus time. I've learned that it's very hard to get a system which is under enormous short-term pressure to think collectively about the much longer term, but we're doing it with strong support, including from both the front line and the top. I've learned that money is important, but actually money is only one of the tools that we need to be using. That actually our status as both the Digital Transformation Directorate of NHS England and Improvement, but also housing the Digital Policy Department of DHSC, means we can do the full span of levers, from project funding and service instructions to legislation and regulation, and we need to be doing all of it to make it work. And I mean, not a day goes by when I'm not reminded that ultimately this isn't about computers and software, and so it's about people, and it's about, I'm sorry about my excited dog who has strong views on digital transformation. It's about people, and it's about systems, and it's about culture.
Great. I think you're absolutely right. Ultimately, it is about patient safety, patient outcomes, and ultimately it's about the care that we offer that person at the end of the healthcare system. So thanks for clarifying that, of course. So thanks for sharing that and being honest and open about where you are. Are there still real barriers that you haven't addressed yet that you'd like to, Matthew?
Loads. I mean, none of this is quick. If we are to drive digital transformation, then I think it's a series of barriers and a series of challenges. So we can, for example, we can come up with a fantastic new pathway for hypertension at the centre and work very closely with the National Clinical Lead and the Royal Colleges and the rest of it. Getting it adopted nationally is a serious challenge. We can come up with brilliant plans from the centre for how systems and providers should make use of digital technology and data. But again, getting that beyond the point where the ones who are keen do it really well, a chunk do it a bit because they feel they have to, and some don't do it at all, that's really tough. So there's a series of challenges. There are some challenges which are just going to be generational, creating a workforce which is genuinely comfortable and excited and has faith and hope in their technology, rather than seeing it as something deeply frustrating that gets in the way of them looking after their patients. That's a long task. Creating patients and citizens who have the enthusiasm, the tools, and the ability to make use of what we could offer, I think, is very exciting. A lot of our, I mean, a vast majority of our citizens are very comfortable booking holidays on their phone and getting their news from their phone and doing all sorts of things. Some are not. Some find it difficult. Some are digitally excluded. Working out what we do with them, working out what we do. I think digital technology and the use of digital isn't even across different communities and different parts of the country. Making sure that what we do is to the benefit of everyone, not to the just to the help of those who have already, I think is super important.
Yeah, and I think you're right. I think there's huge variability, as we all know, across the healthcare system, not just about technology, it's about even clinical work or bringing new ideas into fruition. We always had this kind of difficulty in kind of top to bottom approach. We see pockets of innovation in various parts of the NHS system. How does it coalesce? How do you bring all the parts together? And I think that's the kind of, I guess, challenge that you've had for a while. And hopefully we'll see some kind of better way of disseminating good practice so it's more uniform and technology is part of it.
Yeah, I totally agree. And just on, I mean, on that, there's not a single part of the system I've been to that isn't doing something brilliant in technology. Everywhere I go, even the sort of relative digital deserts, I invariably come across a consultant, a ward, a nurse who is doing amazing things. And the frustrating thing is there's not the sort of natural osmosis of good practice that you would expect. There's in fact sometimes quite the reverse of a sort of, well, we didn't invent it, and just because they do it up the road, why should we be doing it, and we're different. Yeah. And I think we need to get over that. We need to create standards, we need to create clear criteria for good, and we need to do a better job at identifying and sharing best practice.
Yeah, I couldn't agree more. When I'm innovating, doing certain things, we've gone through challenges of governance and rules, regulations, they even disseminate somewhere else, they start all over again, the same conversation. So you're thinking, why not just talk to one another and just get on with it kind of thing. It's always been frustrating from that perspective. That's great, thanks for that. So one thing that leads on from that, which has been a passion of mine for a while, Matthew, which I'd ask you about, how do we bring innovation into the heart of organizations? I'm not talking about technology, but innovation, giving people time in their jobs, giving the workforce the kind of the space to think about innovation, how do you change things, their practices, whatever. I think we've struggled with that because we've been so pressurized in our jobs because of course, it's a difficult, demanding position we have. So how would we bring innovation to the heart of every organization so we can promote some of the ideas you mentioned, Matthew?
So I think it's a combination of bandwidth, culture, and permission, and they all go together. So when I started, I was wondering, why is it that very stretched frontline providers aren't incorporating technology which is proven to ease the load, make them more productive, deal with the thing that they are grappling with? Now I understand it's because if you're living hour by hour, day by day to try and keep it together under enormous pressure, you just don't have time to choose, incorporate, reframe what you do around new technology and innovation. I can understand that. It's a trap you get into, a catch-22, where you need the innovation to get out, but you don't have because you haven't got the innovation, you don't have the bandwidth to deal with it. So we need to create some bandwidth, and we need to create the roles, the CCIOs, the CIOs, the board level support that means that people will be able to make use of innovation. We need to make it easier for people. I talked earlier about procurement frameworks. It sounds very dry. I think it's actually super important, because if you are really up against it, you don't have much time, you don't have much money, and you're presented with a cacophony of ideas and people selling you stuff and everyone telling you what they're doing is brilliant, it can be quite hard to navigate. The centre can really help with that. I think there is a permission point, which is, I mean, one of the things that has been brilliant over the last 8 months, there's been a lot that hasn't been brilliant and a lot that's been very difficult. But one of the things which has worked well has been the willingness across the front line, across health and care, to just get on with stuff, to on the basis of necessity and a common sense of, really unified purpose, do stuff in a way that wasn't necessarily the case before. So instead of making sure that absolutely everything is aligned, every bit of paperwork is filled out, every box ticked and I dotted and T crossed, people were just getting on and building what they needed to build, or getting what they needed to get, so that they could carry on giving the care that their patients needed to their patients. I think if we can bottle some of that permission, that self-permission, it would be great. And that would lead to the third issue, which is cultural change. So trying to create a culture in which innovation, a willingness to take risks, and even a willingness to fail is rewarded, rather than never take risks because you'll get into trouble culture. Now, clearly there are some things you never take risks on. Never take risks on patient safety. You never take risks on patient privacy. Medicine is not the same as the rest of the tech world. But that doesn't mean we can't try things out safely. It doesn't mean we can't innovate. And we need to find a way to get that balance right.
Thanks for that. And obviously now we're approaching winter quite rapidly. We'll see the flu coming to the hospitals, using COVID, again, rising in cases. What are the priorities of NHSX over this period and perhaps in the new year? If you could share that with our audience.
I'm sorry, could you?
What are the priorities coming up during this winter pandemic and next year?
Yes, so the priorities are really the obvious priorities to do what we can that will both help for winter and the short term and the second wave, while at the same time using that as a platform for the future. So it's on Digitize, it's to try and get money support to the less digitally mature trusts quickly, so they can do things with it in a way that I think should be able to help in the short term. On our Connect, it's trying to put in place very swiftly a minimum shared care record everywhere, and just keep improving. One of the most useful things we did in the first wave was to improve through GP Connect, through additional information on the summary care record and so forth, the amount of patient data that can flow through the system safely. So to keep doing that, because it saves lives and improves care. And then the third area in Transform is using digital technology for example, for people with hypertension, giving them blood pressure monitors. It's something we're working up with colleagues in NHS England, so that they can be monitored at home. They don't have to repeatedly go into formal care settings, and a condition which is a contributing factor to severe COVID can be monitored and kept under control at scale.
Thank you for that. And I think we're coming to the end of our session. So I'd like to really just to thank you, first and foremost, both on a personal level, on the work that you've done over the last 18 months to really bring transformation to the healthcare service, which was much needed. I don't think people realize how much work you have done and how many changes have happened without kind of realizing the context of it all. I also thank your team, NHSX, Matthew, all the hard work that they've been doing over the last 9 months to help us overcome some of the huge barriers that we've all faced and challenges over the last 9 months. So it's a pleasure, Matthew. Thank you so much for joining us and sharing your thoughts and your vision and your personal experiences on NHSX. And we wish you well, of course. Thank you so much.
Shafi, thank you. It's been a real pleasure. And thank you for being such a brilliant champion for what digital technology can do for patients. It's been brilliant to watch you in action.
It's very kind. Thank you so much.